We have Barb and Andrew with us here. Just tell us a little bit about yourselves, where you're from, and how you first heard those three little words, congenital diaphragmatic hernia.
Sure. My name is Andrew Carr. My wife Barb here. Originally grew up in Nebraska. We live here in Kansas City or in the metro area. We've been married for 8 years now. And we first heard those three little words. It was either in June or July. I think it was at the 20-week ultrasound is where we first heard those. So, and then quite a ride after that. But.
Okay, well, tell us about your journey.
Sure. So as Andrew mentioned, we've been married for quite a while, and we always knew that we wanted to have a family. And for whatever reason, we were just having trouble doing that. So we had done years of fertility treatments and actually had one pregnancy before our CDH baby. And it was an ectopic pregnancy, which seemed very unusual given all the treatments we were going through. And it was. And so then when we found out we were pregnant, we were obviously thrilled, but given our history, we were kept under close surveillance. So our 20-week ultrasound was a level 2 ultrasound. We went to the hospital for it thinking this is where we're going to deliver, and we're taking pictures of the visiting hours times and all these things as excited new parents. And neither of us put it together at the time, but in hindsight, we were like, you know, the tech that was doing our ultrasound got really quiet partway through, and that was probably when they realized something was wrong. She then had the perinatologist come in and talk with us. She also did an ultrasound and confirmed, yes, this gal found a problem. I can confirm it's the same thing. And what it was Benji's stomach was in his chest. And so that's when she said, we think this is a diaphragmatic hernia. They politely basically said, we are not the experts in this, so we can't answer a bunch of questions for you today, but we are referring you to somebody who is. I have already called the head of this department. You are on the radar. If you don't hear back by the end of the week, you know, please call us and we'll follow up. So fortunately, we heard from that group where we were referred to the next morning. But as you know, 24 hours is a really long time when you know something is wrong with your child. So they scheduled us to have a full workup, but it was going to be 2 weeks before we could get in there. So in the meantime, we had gone back to my OB just for a normal appointment. We told her what had happened. Obviously, she had read the report from the level 2 ultrasound. And I will never forget Andrew looking at the doctor and saying, is my wife going to be okay? And she said, yes. And then he asked, is the baby going to be okay? Will the baby survive? And she said, I don't know. I can't answer that. So I think that was when we were really rocketed into outer space and knew that, you know, we had our fertility team that had helped us get that far. We had my normal OB team that had helped us get that far, but we were truly in uncharted territory. So at 22 weeks, we got into the team of specialists. We both work full time, so we took a full day off of work, and we were at the hospital for almost 8 hours that day. In about 5.5 hours, we had some sort of sonogram, echocardiogram, something where somebody was looking at that baby in my belly. So it was frightening, but on the plus side, we got to see our baby so much more than most people would at that point. So at that point, we were scheduled for follow-ups with that team. We went back, was it a month later? A few weeks later.
A couple weeks maybe.
And that was the one where, again, they were doing ultrasounds. They were saying there could be a heart problem. We won't know until he's born. They were measuring lung volume as best they could, or estimating it.
The LHR, which I think every CDH parent is probably familiar with the LHR.
Yes, yes. And that number would change, and they kept telling us that number will change, and it eventually got to the point they would stop giving it to us because they just said it's really kind of an estimate, and we really just need to see your son once he's born. But I bring up that second appointment because that was the one that was the kicker, where we left the first time with all of this information and knowing that we were in the hands of experts and that this group had a higher than the national average survival rate, and we felt like we're in a good place. After that second appointment, we got our tour of the NICU. We got the tour of ECMO suites should our son need to go on ECMO. And then we walked into a room where the entire team was there, not just the neonatologist that could treat him, obviously the doctors that had been doing ultrasounds on us, the nurses, palliative care was in the room. I'm missing pulmonology, maybe anesthesiology. There was, there was a whole team of people that.
Yeah, as you know, going through life, you're used to doctors' offices and exam rooms and hospitals and everything else. You're not used to a conference room. So walking into a conference room.
There were 2 pediatric surgeons in there.
Yeah, that was a bit of a shakeup too. I don't think you could prepare yourself for what are we doing in a conference room?
Yeah, and we had been warned that every appointment, there's always a range of outcomes. And we always talked about the range of outcomes. And that one was particularly difficult because that meeting essentially ended with the discussion about the worst case scenario and if our son did not make it. So that took the wind out of our sails a little bit. But we knew, hey, we're doing all that we can. That team had said we did not appear to be candidates for the balloon trial, the in utero intervention surgery, because of the LHR estimates. We are fortunate to live in a major metropolitan area, and there are several groups, so we did go get a second opinion. That doctor actually started the conversation by saying, we're still kind of in trials here in the US, and in Europe, they're much farther ahead. So at one point he said, who do you know in
can you go to
Germany, Spain, the UK, those types of things. So I should also probably say at that point, I had been placed on bed rest. In addition to Benji's known diaphragmatic hernia, I had been diagnosed with a full placenta previa. And so there was concern about any activity that could cause premature birth would be obviously detrimental for Benji as well as me. So for one doctor to say, you might be packing your bags for Europe felt a little bit of a stretch. The good news was at the end of his evaluation, and we were at his office about a half a day, he had a much more favorable LHR and really felt like there may be more lung here than what was originally thought, knowing that every time you have an ultrasound, an MRI, any sort of imaging done, depending on shadows or how the baby's laying, things could come out differently. So I just bring that up that, as CDH parents, you're always fighting for knowledge, but we learned pretty quickly that knowledge can be power, but knowledge can oftentimes be conflicting things. And so through every appointment, including after Benji was born, we knew, hey, we both need to take the time off work and be at these appointments, because you may have a group of doctors saying one thing, somebody else is another thing, a specialist may have a different idea, and we really needed to make sure we were on the same page and pick the best path for our family.
That makes sense.
Yeah. Do you want to pick up?
Pick up from the second opinion?
Yeah, probably.
So from there, I think we went back to our normal team, and we were open with them. They knew we got a second opinion. They were open to that as well, which is one of the reasons we loved them. That they wanted what was best for our family, and if that meant getting a second opinion and taking a different path, that was fine. So we went back to them and discussed the results and said, that it was all kind of based on the LHR that we talked about before. And for anyone who doesn't know what an LHR is, it's essentially an etch-a-sketch of drawing around an ultrasound picture of the size of the lung and then measuring the size of that lung to the size of the head to just give you a sense of volume that could potentially be there. And it's a 2D map of a 3D, little baby that's in there rolling around, and it's very hard to capture accurately. So we told him that, the LHR at one place looked different than the other place. And they said, it's perfectly reasonable that it would, just depending upon how Benji was laying or where he was in utero. So we said we're going to stick with the plan. Obviously, Barb can't get on a plane and fly to Europe with the full placenta previa, but it wasn't even recommended that we do so. So once we saw that, they said, you're probably not a candidate for that trial. We thought Benji's severity case was in the moderate range, which is still obviously a devastating diagnosis, but moderate is
it could be worse.
Yeah, it could have been worse. So we were hopeful that he would come through birth just fine, and we could get to the repair at that point and move on. So fast forward probably another month or so, and Barb was put on bed rest in the hospital, just going through our normal appointments like we always would. Her hospital was right across the street from where Benji ultimately ended up, which was great. So the team of doctors moved from one hospital to another. They worked hand in hand with each other, which was great. So his team would come over and check on Barb. Barb's team would be there, obviously checking on her. Every couple hours she'd be either on a monitor or getting tests, just make sure she was okay.
So we did that for 3.5 weeks, and then had scheduled the C-section. Sorry, just to make sure we got that in.
Yeah, so we were there for 3.5 weeks until we decided that it was time to go. So we were trying to shoot the gap between what's the best time to deliver Benji. Obviously, with the CDH, you want it to be as late in the pregnancy as possible to give that lung or those lungs as much chance to develop as you can.
And to make sure he would be big enough if he needed to go on ECMO, that he could do that.
Right, and so could sustain through surgeries and things like that. So, and the other side of it is we want to go as early as possible because of the placenta previa and make sure Barb was safe. So we kind of agreed upon, we got past 36 weeks with Benji, and we said, okay, he's, full term technically, so that's okay. We didn't want to go to 40 weeks and put pressure on Barb, so we said, let's do it at 37 or 1, I think is the date that we picked, or that the doctors had suggested, and we said, okay. It was a Friday, so we could, I was still working up until that week, so I could say, okay, at least, I'll sign off on Thursday night or whatever and disappear for a while. So we did. We got up Friday morning. We knew that was the plan. We had all, our immediate family was in town that lived out of town. The family that was here was there.
We had a doula.
The doula was there. Obviously, she was great throughout. We had somebody from our church there. It was, everybody was there. There was probably 15 people there that morning, ready to go in our room. So we did what we needed to do then.
We had a prayer circle.
Yeah, obviously a little nervous waking up that morning, not knowing what's going to happen. Barb was obviously concerned because she knew that Benji was safe as long as he was inside her. He was fine. Once he came out, we didn't know. So that was the hesitation there. But it was, at that point we knew what we needed to do, and we decided to get it going that morning. So it was a dark and stormy morning. It was a stormy week that week. We had a lot of rain here that week, but it was just you knew it was going to happen. There's lightning and thunder all around. So everything just started happening. We went in, they prepped Barb at the hospital. It was obviously a very different C-section than most. Obviously Benji's team was in the room, Barb's team was in the room. Myself was in the room. They could only have one of us in there at the time, so our doula and I swapped out when I left with Benji, but I was in there for the time being. What did we say? There were probably 15, 20 people in the room.
I think there were closer to 30 to start.
It was a big, it's quite the delivery room. So we got started, kind of going through the motions. From my perspective, obviously as the dad, there's only a certain few things you can do, and one of them is to not pass out. So we had all the tricks. I had peppermint in my pocket, ginger, I was ready to go, and I used every bit of it needed. So we got through the delivery. Obviously it was uncomfortable for quite a while for Barb, was when they were doing the work they needed to do, and then out came Benji.
And everything was really pretty much on time at that point.
It was on time, on schedule. It was moving like clockwork, like it was supposed to.
And we had been prepped. We knew as soon as he's born, we will take him, we will intubate him. This team is here to do that, those types of things. And I will never forget, we looked at each other and we said, did you hear that? And so Benji let out 2 really kind of faint wails as he was born, which as a CDH parent is terrifying because he's ingesting air and he shouldn't be, but was also a beautiful thing because we didn't know if we would ever hear his voice after that. Yeah,
so he cried a couple times. I think I was nervous hearing that because we knew that, the longer that he was out without being intubated, the worse it would be. So we didn't really want to hear it, but we were excited to hear it at the same time. So Benji immediately went to the side of the room, which was to our left. One of the doctors came over because at that point I could get up from sitting with Barb and go over and be with Benji while he was still in the room before he left. So I got up, went over there, and kind of watched and listened and kind of took it all in. And as they were working on Barb, doing their thing over there, and then on the other side of the room, they're trying to intubate him and going through all the struggles with the right size of tube and everything else then. And, you know, at that point, it's like, okay, I can kind of understand what's happening. Not being a medical person, you hear what they're saying, you assume it's good or bad without really knowing whether it truly is or not. But yeah, that's tough watching an infant that's been out of the womb for 5 minutes being intubated and them working on him as feverishly as they could. So I went back and sat down with my ginger and peppermint as quickly as I could and safely as I could.
And of course I said, what's wrong? I can't see anything. Tell me what's going on. Why are you here? We had this plan. You're always supposed to be right by the baby in case he doesn't make it, that there's a parent there. And he just said, they're just working on him. Just give him a minute.
I can still see him. I just was sitting down.
Yeah.
But so then from there, they got him ready to go and came over and brought him up to Barb's head so she could see him before we took off. So at that point, he and I took off down the hall for the NICU at that hospital.
And about half of the people in the OR went at that point.
Yeah, his crew went with us. And that where, do you want to go your story or his story from there?
It doesn't.
So we'll keep going with Benji. So we went down the hall. They did the normal things that they do with the newborn, as far as I know how to do with a newborn. They took his footprints, measurements, things like that. All the while he was intubated on the bed on a warmer, just making sure that he's stable and everything. At that point, he was really doing pretty well. Aside from being intubated, his level of support, they were able to wean him a little bit there, which was obviously encouraging. You want to hear, weaning and minimal support as much as you possibly can at that point in the game.
I think we'd also been warned that oftentimes these babies may come out better than what you would think. But the first 24 hours is really critical because there's still a lot of that goodness and the oxygen they got from the umbilical cord and all that that's still in their system. Right. So it was so easy, I think, to be optimistic, but, cautiously so.
Yeah. So we're down there in the NICU, kind of going through the motions. They're doing blood gases, things like that, just to, see where he really is. And that takes some time. They were coming in doing scans of different sorts, ultrasounds on his brain, things like that, just to make sure that, to see where we really were. So we were down there for a couple hours. And I would, through the whole time I was texting our doula saying, here's where we are, so she could relay it to Barb.
Because the doula had come into the OR with me when Andrew left, then our doula could come in with me. So
yeah, so we were in there for a while, and at that point it's kind of a blur at this point before we made the jump back to the children's hospital.
So before they transported Benji to the children's hospital across the street, I had stayed in the OR, and it was another 2 hours before they were really ready to close me up and say, okay. And of course I have no idea what's going on. I think I had been on basically every anesthesiology cocktail available at that point. But the beauty of it, if you will, is that it took them that long to get Benji stabilized to move him. So with Andrew texting our doula and this, that, and the other, she texted him and said, we're fine. Barb's finally in recovery. And the team working on Benji knew that at this hospital. And so they said, okay, we've got a very short window, but we're going to have to move him to the hospital across the bridge anyway. So before we do that, they basically went the other direction and brought him down the hall. So that was really the first time I got to see him. They brought him in next to me. They dropped the side of the transport unit so I could say his name. And we had socialized the name of our son before he was born because we wanted the team taking care of him to know it, and we wanted people to use it with him.
The team really encouraged that. They asked us early on, so what's his name?
Yeah.
And they referred to him by Benji from that point on.
Yeah.
So.
Yeah. But that was the first time, they dropped the side and I could say his name, and I will never forget, he turned and looked at me and I could hold his little hand and just got to do all those things that you just don't know if you're going to get to.
Yeah, so that was a pretty dramatic couple minutes there as we left the NICU at that hospital, went to see Barb in recovery. She was obviously had gone through her own very pretty traumatic delivery, which was no easy, whatever anyway. So then Benji and I and his team took off down the hall. There's a bridge that runs across the street from one hospital to the other. So we were going across that bridge
to the Children's Hospital.
To the Children's Hospital,
yep.
And I had run into, just happened to be because the two facilities connect that way, the doctors and things go back and forth all the time. And I happened to run into one of Barb's doctors in the hall as we were going across, and he's just stopped me and he said, "Have you talked to the doctor who did delivery?" And I said, "No, I haven't seen him. Why?" And he said, "It was a rough delivery." And that's all I really said. I said, "But he'll be over to see you in a little bit." It's like, okay. So off we go. We get to the Children's Hospital, get set up there. We are in an ECMO suite at that point, just by happenstance. I don't think that was intentional. Like, that was the bed space that was available. It was a shared room, so there was another baby in the room at the time. So we get in there, get set up, all the chaos that goes along with admitting anybody to a hospital. You've got, the entire team rolling in there. The team that's on duty at the time is in and out. You've got the nursing staff, everything.
And this was midday, just to kind of try to level set.
Yeah,
so Benji was born about 8:30 in the morning. So it's pushing noon at this point when they're getting him settled in at the Children's Hospital.
Yeah. So we get there and get set up. When mentioned earlier, they were weaning his support a little bit. I think the jaunt across the street took a lot out of him. So he was kind of struggling at that point. He needed a little bit more support. I don't remember what point that day. It couldn't have been too long, and he got bumped to the oscillator, which is another intervention tool that they can use to take some pressure off the lungs instead of the ventilator that takes deep, normal breaths. An oscillator takes very small, short breaths, so it kind of doesn't force the lungs to work quite as hard.
And his team, the neonatologist that was there at delivery, had warned us when we were in recovery and had said, I would expect that he will be put on an oscillator once we get him over. And so again, as we've been through all the appointments, we talked about the range of outcomes, but we just said, okay, that's a term we've heard before.
So at that point, he was on the oscillator. They were managing pain, all sorts of other things to kind of make sure that he was comfortable, which was their goal at that point, make him as comfortable as he can possibly be, at the same time making sure that he's stable. Some of the things, I haven't gone back. We've got basically a diary that keeps track of everything that was going on. I haven't gone back to look at that, so I'm trying to remember what all we were dealing with at that point. It was blood pressure was a big thing that I remember they were watching. His blood pressure, his oxygen sats obviously were very low. They were, even though he was on the oscillator in the vent, it was great to see him above 90, which is, is not great. But the blood pressure was the thing that they were the most concerned about, for the first few hours over there. And his blood pressure, and they use an average instead of using the two numbers that they use when they talk about an adult's blood pressure. They just take the average of the two numbers. And I remember the average of the numbers for him was, it was, in the 30s for a while. It was in the teens for a while. His blood pressure was like 25/12 or something like that. Just extremely low blood pressure. And that was something that I wasn't entirely educated on about the time. You're so focused on respiratory issues and lungs and oxygen, things like that. You don't even really think about blood pressure. So I was kind of caught off guard by that. And this whole time you're just kind of staring at monitors, listening to people come in and out in conversation, not really know where to ask questions, what to look out for. You're just basically kind of sitting there and listening. So they were dealing with that for a while.
And poor Andrew is doing all of this, I say by himself, but all of our immediate family that had been at the hospital, we had said, you need to make sure they get to come in and see Benji, because they hadn't seen him yet. My sister had been in recovery with me and our doula when Andrew and the whole team came in with Benji. And that was it. So, our mothers, my dad, wanted to meet their grandson. So poor Andrew is going through all this, and they're trying to keep Benji low stimulus, but also, okay, one at a time, people are coming in to meet this baby because we don't know if he's going to make it. Yeah,
the low stimulus thing was hard for people to understand. I mean, he's obviously in a dark room with a lot of alarms going off and things like that. But, the intention there is to keep him from getting anything that would raise his level of agitation, because that's going to make him breathe harder, make him concerned, things like that. So you want to keep it as calm as possible in there. When you've got new family members, I mean, he's the first grandson on Barb's side of the family.
And yours.
Yeah, first grandson on both sides, first grandchild on Barb's side. everybody's was really excited to see him. And there were points when we were kind of cycling people in and out two at a time. So there could be 3 at his bedside at a time. So it was me plus 2. Or there were times that afternoon, I remember when we had to, we asked the nurses and say, okay, no more. It's too much for him. He needs to be left alone for a little while. So we did that, throughout the day, so that everybody, that whole group of 15 that was there at the morning before his delivery, had got to come see him if they wanted to, which was great. And then that evening,
we'll talk about when I
got
back.
Fine. Yeah,
that's okay. I did not know this at the time, but I was informed afterwards that the Children's Hospital had actually called over to the hospital where I was recovering and said, baby is not doing well. You need to get mom over here. So, of course, that morning I'd been told it will be a few hours. We'll have to get your catheter out and see if you can stand up, and then we'll take you in a wheelchair over to see. And all of that was quickly accelerated. And it was to the point I didn't have the hospital band yet for the Children's Hospital, and they didn't want to let me in the door. And it was like, hey, you've got to get this mom in. So
yeah, that was one of those times where we had to ask some of the guests to leave. And I remember asking the nurse at that point, I said, is it time to get mom over here? And she said, yeah. So
Benji was about 7 hours old at this point. I had just seen him, when they wheeled him up in the OR, and I could see him, and then the 2 minutes that we got in recovery. So I got through the security and all of those issues and got in to see him. And I remember the nurse saying, okay, do you want to give him a kiss? And I remember thinking, I just had a C-section 7 hours ago. Is this like a test to see, can I stand up and bend over? And knowing what I know now, it was give him a kiss while you can, because we just don't know. Yeah,
so, kind of skipping ahead a few hours, they mentioned ECMO that night, which we'd already had the conversation about ECMO. It was obviously a kind of a last resort type thing. We knew there wasn't another option past ECMO.
Which to this point had helped us, because we weren't at the end of the road. There was always another intervention or option that we...
obviously nothing cures it, but there's another step that we could take if we need to. So that evening, one of the doctors came in and started talking about, we're going to do another blood gas. They were doing blood gases every 15 minutes, I think, at that point. And said, we're getting towards that. If something doesn't change the next few hours, we're probably going to go there. We said, okay, that's, we knew that was a possibility. They told, when we originally brought it up, we thought it was a possibility a few days down the road. We weren't expecting it on the same day. But, at that point it was late in the evening, I think, and I had a room in the hospital. They would put me up in the NICU. There's a room that they keep for parents. So I was there. I was just down the hall. I said, I'm going to go get a few hours of sleep. At that point, they said no ECMO tonight. He's hanging in there. So
he wasn't getting better, but he wasn't getting worse.
Pretty stable. So he was still on nitric. He was still on the oscillator. It's a side story about the oscillator. Every time, that's one of those sounds that you don't forget. Every time we go back to the NICU for appointments and things like that, you hear a kid on the oscillator and you go, oh man, never gonna forget what an oscillator sounds like. But so anyway, so I go to bed. I get up in the middle of the night to go check on his blood gases. They said they were going to pull him again around midnight. So I get up and go at midnight, go check on him. Not much else has changed. So I go back to bed for a little bit. Next morning, we get up and kind of everything starts. The kind of the vibe of a hospital is very different overnight than it is during the day. During the day, you've got all the daytime crew in there, whether it's, therapists or, just kind of the normal crowd. And at night it's more kind of a bare bones. You've got the nurses that are working with the patients, and then you've got the doctors that are on duty that night. It's very quiet. So once things kind of ramped up in the morning, you kind of get the sense that things aren't looking good. Things change a little bit. They can't get his blood pressure stabilized. His oxygen numbers are hanging in the 80s now instead of at 90. They're dipping into the 70s at times. And at that point, I think it was around lunchtime when they said, I think it's time that we do this. So at that point, I remember they brought in the consents, the consents that you have to sign, basically saying that, yeah, you would acknowledge that there are side effects or things that can go horribly wrong. Is basically all you're doing for every procedure. I think I'd signed a couple to that point based on various things that they were doing. But we held off on signing the consents because I wanted to go across the street and talk to Barb. So we went over there, had that conversation, and then I think we both just, the decision had been made. We made it before he was born. We'll do whatever we need to do. And if ECMO It's what we need to do. We'll do it. So we chatted about that, made sure we were on the same page, made sure she was doing okay with her recovery. Went back, signed a consent, and got ECMO going. You know, an ECMO was one of those things that's, up until that point, he was doing a lot of the work. You know, he was, you know, we were managing his numbers. Obviously, the oxygen numbers were very concerning. The blood pressure was very concerning. As soon as he got on ECMO, all of that kind of stress and anxiety just went away, because we knew that his numbers were fine. The machine was breathing for him. It was taking care of the oxygenation of his blood. It was taking care of the work of his heart. So his heart and lungs could stop and rest. And we knew that he was, as long as he was on ECMO, he was fine. We knew he couldn't be on ECMO forever, but as long as he was there, kind of our worries kind of were like, okay, now we can focus on other things, making sure there's not brain bleeds, other things like that come along with ECMO. But it wasn't the structural problem with his organs that we were dealing with before.
The other thing, though, with ECMO was it accelerated the plan of when he would have his repair surgery, because we knew, because he was on constant blood thinners, to have these constant transfusions, that we were going to need to do his surgery fairly quickly.
Yeah.
He had been diagnosed with a left CDH, which means he had his small and large intestines, his stomach, and part of his liver were all up. So before he was born, on the imaging, we'd been able to see a right lung, which obviously was malformed. We could not even see a left lung. They didn't even know would it inflate once things had been moved. His heart was pushed so far over, it was almost touching the opposite wall of his chest cavity.
Yeah, basically put those ribs on his right side.
Right. So Benji was 1 day old when he went on ECMO.
Went on Saturday. Yep. Sunday he rested. It was basically a day just give his body a chance to sit on ECMO for a while, recover from the cannulation process. He had I think he had a chest tube at that point, just to kind of monitor other things. And they were running all sorts of tests again to make sure that his body was stable enough to have the surgery the next day. So Monday morning, he was scheduled for the surgery right away. At that point, we learned there's a difference between urgent and emergent. So you always think that if somebody needs surgery, it's going to happen right away. And obviously, he was an urgent case, needed to happen that day. But the hospital is still running with emergencies that come in and out. You know, there are kids that come in with all sorts of problems that are emergent, that need to be dealt with right away. It took the surgery team to do other things. So it was a few hours kind of after schedule before they were able to get in there and do his surgery. They told us up front it was probably going to be a couple hours. It was a couple hours plus one, I think, right?
Plus
it was
2.
3 or 4 hour surgery.
Yep. Which is the parent, you never know.
You assume the worst, but
you
yeah,
do.
as long as they're in there operating, you're like, okay, at least they're still working. And we'd had a couple times. The surgeon, I don't remember if the surgeon had come out mid-surgery, but some of the other doctors that we'd worked with had been in and out of the surgery room that were keeping us updated as to what was going on, which was very helpful. And so by the time they got him patched up and back out, and the surgeon came out to talk to us, again, we had our whole crew family there in the waiting room, and he pulled the 2 of us off to give us an update as to what was going on. It came out, in his words, it was as good as it possibly could have. He ended up with 2 patches. One, the defect was pretty severe, as we knew it would be. Obviously there are a couple things you worry about. Obviously, the size of the lungs is the big piece of it. The other piece is how big is the hole in the diaphragm? Because if it's too big, it can't really be repaired. If it's big enough where there's some tissue there that they can patch, that's better. So the hernia, which is the tear in the diaphragm or the lack of tissue there, was pretty severe. He did have some tissue on the back, which gave him something to work with, so that he was able to get a patch to cover the hole, obviously get everything back down where it should be, relatively. I mean, the organs that were supposed to be in his abdomen were now in his abdomen. They're not necessarily in all the right order that they would be for a kid who didn't have something like this. But they got the patch on the diaphragm, which was great. One of the problems with having all those organs up in his chest is that his little belly didn't have enough tissue in it because there were no organs down there, so it was just kind of collapsed and it didn't have a chance to grow. So one of the problems they had patching him up is that once they got all those organs back down in there, the incision wouldn't close. There just wasn't enough tissue to close the incision.
In his abdomen.
Yeah. So they had to use a second patch kind of under the skin there so that they could actually close the abdomen up. So that was in place. He said, you know, everything's good. At that point, he definitely had a chest tube. They were watching drainage from that. It was still on ECMO, obviously. And that at that point in time, his lungs now, for the first time, actually had some room to fill up and to grow kind of unimpeded with all the other organs out of the way. The heart, within a day or two, I want to say the heart had moved back central chest, which they didn't think that would happen. They kind of thought it would still hang out over on the right. It came back center chest. Both lungs started to look like normal, natural lungs to the point that they could. Obviously, they were still malformed and not 100% complete. So we sat there and recovered for several days. I mean, we went through the normal ups and downs, which it seems like normal ups and downs. To us, probably our normal ups and downs. He was getting MRIs constantly. He was
severely sedated.
He was on morphine and some of those drugs and fentanyl that, you know, they said, you know, there's only a certain amount of time that you can be on those drugs before other problems develop. So they were constantly kind of mixing his pain medication to make sure that he was safe.
But he first opened his eyes. I mean, we saw him obviously after delivery. So he was born Friday, went on ECMO Saturday, repair surgery Monday. And I remember Tuesday I was over recovering at the adult hospital, and Andrew texted me a video late in the day on Tuesday where our son opened his eyes and looked at him for the first time, and it was pretty incredible.
Yeah. Yeah, obviously he's very swollen,
Yep.
Which again, you don't think about those things. You don't really understand it when it's going through. You go back and look at pictures now with all the fluids that he was on and everything. He was very swollen.
The next day he got his warming bed back. So instead of being on an OR bed, they were able to swap him back into his giraffe warmer bed. He's still in the ECMO suite, of course, but we just felt like it was one step back towards being more of a normal baby, if you will.
Yeah. So he laid on an operating table for a few days, which is kind of terrible to think about, but they needed it. You know, they didn't know when they were going to have to go back in. They weren't going to risk transferring him because obviously transferring him attached to, you know, pre-ECMO, all the things that he was attached to, the vent, the oscillator, the nitric, you name it, in order to get him on from one bed out the other. I mean, you know, 5 people picking his little body up, taking him one bed out, bringing the operating table in and setting him back down. Because they did the operation right there in the same room, which was fantastic. They didn't have to put him on an elevator, wheel him down a hall, anything like that. They just converted his room to an OR. But the process they went through just to pick his little body up, move the bed out, and put him back down was pretty traumatic. And it took him time to recover just from that type of movement. I remember, you know, it was a few hours before his numbers kind of stabilized again after kind of picking him up and putting him down. So by Wednesday he was back on his normal little NICU bed with a warmer on it.
At that point, I was discharged from the hospital, so I was then posted up with Andrew, sitting by Benji's bedside. We were given rooms at the children's hospital again to stay because our son being on ECMO. And again, they didn't tell us this at the time, but after the fact, they told us he was the sickest kid in the NICU. And the facility we were at can take up to 84 children in the NICU, but they said before ECMO, he was on maximum medical management. They had done everything they could for him.
Yeah.
And he was put on ECMO to give his body time to heal and recover and see what he could do.
Yep. And so later that week, they made the decision, you know, everything looked okay. You know, we had trusted the doctors and his team a lot up to that point, and they made the call that said, look, I think it's time to decannulate, take him off ECMO, and we'll see what happens. So we did. That was quite the morning as well, but he came through that incredibly well.
He was a week old. He'd been on ECMO for 6 days.
Yeah.
And the team had, you know, they had always told us, we really won't know until he's born and we see him. We really don't know exactly what we have to work with. And then, you know, a lot of it is up to the baby. And we knew he was feisty. That was part of the reason they had a hard time intubating him in the OR right after birth. But the team kept saying, he'll let us know when he's ready. And I'm like, that just seems so foreign to me. And then we just knew that day. You could tell the vibe in the room. You could tell the excitement. So he came off on Friday, he was a week old. And it was that next day when he was 8 days old was the first time I got to hold him, which was incredible. And then I think it was a day or two after that, Andrew got his first time to hold him. And so it's just amazing. We tried so long to have a baby, and, you know, I mean, you see it on any TV commercial for baby products, right? You have your baby and they're immediately put on your chest and all of these things that, you know, we knew we were going to have a different road, but you don't think about when's the first time I'm going to get to hold my baby. And you don't think about it's going to take 2 respiratory therapists and 2 nurses and 2 other people just to transfer your baby in your arms. And you have to make sure he doesn't turn his head because he's still intubated. And, you know, all these things that in the moment, you're just so excited to hold your child. But, you know, going back and looking at pictures, and it's very hard to explain that to somebody who hasn't lived that.
Yeah, I mean, he was still on a vent at that point. Went through all sorts of, the next couple of months that he was in the hospital after that, he was there for 10 or 11 weeks. He went through, you name it. So the first day that I got to hold him, I'd never held a newborn before, I didn't. But I knew something was strange, something was weird about the way he was breathing. Turns out he had pneumonia. So, I mean, you're constantly dealing with things like that. And we went through, he thought he was having seizures at one point. So we had a brain scan, make sure that we could rule out all sorts of things for that.
You had an EKG, you had to wear the sensors for 24 hours. He needed follow-up blood transfusions. Obviously, when he came off ECMO, a few days after that, they needed that suite for another child to go on ECMO. So then we were moved out into more of kind of the general NICU, which the setup we had was there were different pods, and each pod had anywhere from 8 to 12 beds. But again, then your privacy is basically paper curtains. And so the level of noise, and in addition to Benji's equipment and alarms ringing off, you're hearing everybody else. I'm trying to get my milk supply up so that once he can work on feeds, we can do that. It was just a very stressful time. He was still intubated for about 3 weeks. And then he had his breathing tubes swapped out for nasal cannulas. 1 day short of being 3 weeks old was when they made that switch.
They stepped him down. He luckily never went back on the oscillator after his repair, but he was on a ventilator for quite some time. We had all sorts of problems with the ventilator. Obviously, everything that's going on now, you know that a ventilator is not a cure, and there was problems with ventilators all the time too. So he was high pressure in his vent. He was blowing over the top of it. You know, it took forever to get that figured out. And then he stepped down to a high flow cannula. Was there for a while.
And the nice thing at that point was then we could work on oral feeds. We knew with CDH babies, there are often oral aversions, but he would take a pacifier, which everybody kept saying that's amazing, and that's kind of rare. So the next month or so was really, you know, working on feeds. We had follow-up echocardiograms. There had been concern about his heart, and basically the long and the short of it was the valve that usually closes once a baby is born had not completely closed. But even now, to this point, you know, they've said it should be okay. A lot of adults have that, and we just don't know it because they haven't been under the careful imaging and routine scrutiny that Benji had faced. So the next month was great because other family members could start to hold him. You know, our parents, my sister, I'm very close. I have a twin sister who lives locally, those types of things. But we were still having to do things like, he's acting funny, we better get an x-ray and make sure he doesn't have fluid in his lungs. Or there would be a blood test and something didn't seem quite right. So he did have a follow-up kind of blood transfusion. He was very pale, lethargic, was getting sick, but we were able to start using some of the other services that the NICU offered. The music therapist would come by a few times a week, and Benji really responded to that. We had learned at that point that you could sign a nurse to be your son's primary caregiver when they were working. So we had a primary day nurse and a primary night nurse. And again, they didn't work every day, but it just helped because we felt like here's somebody that really knows our son and will have a better intuition of something isn't right. Of course, at this point, we had to go home at night. We couldn't stay at the hospital forever, and it just gave us peace of mind. And we could always call in the middle of the night and kind of get an update and that type of thing. Let's see. We were slated to bring Benji home in early December. They thought everything was going well. It was the first week of December. We'd already had our first blizzard and everything here. The roads had been cleared, so we thought, great. We did the parent care room stay overnight where we took care of Benji. We knew at this point he was going to still go home on oxygen. We had tried to wean him and got down to about 1/8 of a liter, and it was a lot for him. So they said, hey, we're going into cold and flu season. We really would prefer to get you guys out of here and get you home. And Dawn, I know you're familiar with this. The longer they're in the hospital, the more susceptible they are to pick something up. So we talked about it and said, hey, if that's the best thing for our son, we'll figure out how to deal with this equipment and we can do it. So we did the parent care room. So we were the primary caregivers for our son, but we had the nurse's phone number, and she also would come and check in to make sure everything was going okay. I think between the two of us, we maybe slept an hour total that night because the monitor would go off and we'd jump out of bed and say, what's that? And really it could be he kicked his foot and it was just a false read for a minute. So we were prepared to go home. My parents were on call waiting for us to say we're on our way. They were going to meet us at our house. And our primary day nurse was working that day, which was great. She was going to be the one to discharge us and help us get everything packed up and ready to go home. And she came in and she said, the surgery team wants to take some more images just so we have that for Benji's file. So this will essentially be, here's the baseline. He's had his repair. He's gone through his breathing treatments, all of that. This is the baseline for sending you home. So they came in and did a front view and then kind of a lateral sideways view and then left. And we thought, okay, that's just customary, as did our nurse. We just thought that's just to have for the file. So we were waiting for the doctors to make rounds and basically come in and say, we've issued discharge orders and we'll get you set up. And instead, the doctor came in and had a very different story. You want to do this one?
Yeah, he basically said, we think he's re-herniated, which for CDH parents, that's the thing you're always afraid of is that patch not holding,
yep.
Or another tear in the diaphragm to open back up. And they said, something doesn't look quite right. He's not having the outward symptoms of it. There are very clear symptoms that they warn you about and they teach you about to look out for when he gets home, to know what a true sign of a re-herniation is. He wasn't having any of those. They just said the imaging doesn't look right. It looks like part of his intestine had popped back up above the level of the diaphragm.
Mm-hmm. So at that point, they said, you can't go home today.
Yeah, I said, we're not going home today, which is like, all right. So at that point, we're thinking another surgery, another repair in the next couple of days, get him patched up and see what happens. So, we had a few more conversations with the surgery team there, and they said, he's still pretty young. He's only 10, 11 weeks old. He's still pretty small. He was only, 12, 13 pounds maybe at that point. Maybe smaller, 10 pounds.
No, I think he was like 8.
Yeah, he was pretty small.
He was a peanut.
He was a little peanut. So they said, we're really better off, since he's not having those outward symptoms that they warned you about. They said, let's make sure he gets a little bit stronger, a little bit bigger. We want you to go on home.
They were also concerned about the location of it. They had said where it was difficult to get to. So
they thought it was hiatal. They thought it was center cavity instead of one of the sides. So they said, we're going to send you home. We think you've got all the equipment you need. You've got all the nursing care available from home if you need it. So let's wait. We're going to try to hang on for 6 months, let him get bigger, get stronger, get adjusted to life at home. Because one of the other things they always told us was they weren't pushing us to go to the hospital, but they did know that kids flourish a little bit better differently at home when they kind of know they're not in a hospital anymore. So that was a big goal for us, was to get him home and to see how he responded. So we spent another couple nights at the hospital.
Just to keep an eye on things and make sure there weren't other signs of problems. And it also gave us time. We knew about his diagnosis when we were pregnant, and we still celebrated with family, and family still threw us beautiful baby showers and all of that, but we were cautious. And so, all of his bedding and clothing and things like that he couldn't use in the hospital anyway, we hadn't opened because we didn't know if we really could set up his nursery or would we need to return things. So that gave us time to really feel like, okay, let's get his space set up. We also knew at this point that he was going to be tethered to a concentrator. And so we had to kind of redo our setup because we knew he needed to be in our room 24/7, where we were right by him.
Yeah, so it took a couple of days there while we were back at the hospital. Obviously, that was kind of a body blow, I guess, to go from an hour away from taking him home to saying we need another surgery. So it took us a couple of days, I think, to kind of digest and say, okay, we really are okay to go home now, even though we think we might potentially have another hernia to deal with. So we got him, I think it was middle of the week. We were supposed to go home on a Saturday. We went home either Tuesday or Wednesday. Maybe it was Wednesday.
It was Thursday. So it was 5 days after what we'd originally thought. And it was also a little less than 2 weeks before Christmas. So we really felt like, hey, this is a miracle. Our goal had always been, let's get him home by Christmas. At one point, one of the doctors thought we may get him home by Thanksgiving. We clearly didn't make that, but to be home by Christmas, we felt like, okay, little buddy, this is a win.
Yeah, get him out of the hospital before flu and RSV season was a big goal. That stuff floats around the hospitals as much as they want to try to prevent it. It happens. So getting him out of there, I think, was a good thing. So we got him home, adjusted to life.
He had his first pediatrician appointment, so he was measuring about 9.5 pounds at that point. So again, he's almost 3 months old at this point, so he's still pretty small. CDH parents will know that you're constantly working on feeds. So we've been working on breastfeeding, but then we're also following up with very heavily fortified formula bottles just to try to keep the weight gain going and that type of thing. So that was kind of December, right before Christmas. Took him home, kept having our follow-up appointments with the neonatology and special care clinic at the Children's Hospital. He saw the pulmonologist, he saw the cardiologist. The cardiologist essentially said his heart looks good. That valve is still partially open, but it's not seeming to cause any problems. So she actually discharged him and said, I don't think I need to see you again. We'll do a follow-up in a few months and call it good. So kind of the usual, staying at home, taking care of him. I ended up, my maternity leave came to a close, so I had to go back to work. And then Andrew's employer had a leave policy where then he could stay home and spend some extra time, which was great. So that takes us to the middle of April. So Benji is 6 months old. We went back to the Children's Hospital for what we thought was his reherniation repair. We checked in. Our church clergy was there. Again, we did a prayer circle. They took him back. And there had been kind of this plan about how they would enter, if they could do it just through a couple punctures instead of having to fully open him all the way back up. And we were getting calls, updates from the OR, but it was very confusing because it wasn't really aligning with the plan that we understood before. But the long and the short of it was after the surgery, the surgeon came out to talk to us, and he essentially said he did not reherniate. Yes, on the x-ray image, there was kind of a bowel loop that was higher than normal. But when they put in Benji's patch, they didn't do it completely taut, and I'm really glad they didn't. What had happened was, as he grew and things shifted a little bit, that pouch had bowed a little bit. So they were catching a piece of the intestine, but it was still below his patch. So the surgeon essentially said, we would not have known this without being in here and seeing it. So I'm sorry he had to go through surgery to do it. Fortunately, they hadn't opened him all the way back up. So his incision and everything that had healed pretty well was still intact. They did clear out some scar tissue and that type of thing, which I think helped make him a little more comfortable. And the challenge from that point was, even though they hadn't done a massive repair, Benji was still in a lot of pain. And so, we talked about Benji had been on morphine and some heavy narcotics when he was in the NICU, and we'd already gone through the pain of watching our son go through withdrawal as they were weaning those medications. And here we were back inpatient, and they were having to give him morphine just so he could sleep for an hour at a time. So we spent another couple nights there. We were not in intensive care. We were on a floor room, so we were both there with him all the time. But the best news of all was we got to bring him home after a couple nights. So it was actually Good Friday that we were discharged and got to come home and just keep an eye on him and really let him heal. The other great thing about that weekend was that Sunday we took him to my parents' house for Easter dinner. And that was the first time that Benji had left our house and it hadn't been to go to a doctor or a hospital. So again, he was very insulated and he still is. He can't go out in public. He's never been shopping or to a grocery store. He's been to a park a couple times. We had his 1-year birthday, which was a huge bash. And our friends always said the first birthday isn't as much about the baby. It's more a party for the parents. When you have a baby that had a scary diagnosis like he did, there were a lot of people that hadn't met him. There were people that had been to baby showers, had sent home cooked meals to us at the hospital, had mailed gifts for Benji, but had never met him. And so his first birthday was their chance to do that. So we had to remind everybody, if you've had any sign of any respiratory anything, even if you think it may just be allergies, please don't come. And we rented a shelter at a local park so that we at least were outside in open air. But it was a fun party. It was a good day.
Yeah.
So today, Benji is 18 months old. He is really doing well. We have changed things a little bit. Do you want to talk a little bit about being kind of under quarantine with the COVID-19 pandemic?
Yeah, so we're kind of used to, we thought we were used to quarantine life with him before. Like Barb mentioned, he'd never been to a grocery store or a restaurant. We sat on the patio at a restaurant one time. It was nice outside, so you didn't have to be near people. But it's obviously a little different when you're dragging oxygen equipment with you. But he's been off oxygen for a while now, so we don't have the equipment. We have obviously emergency tanks and things like that here if we need it. And he still sleeps with a monitor attached to his foot, so we know his pulse and his oxygen rate when he's asleep. But so quarantine for us is a little bit different. I mean, we had kind of gone about our business. We both travel for work, in and out of airports, things like that. But we're very cautious with him. When we get home from a trip or come off an airplane, we immediately jump in the shower, get everything, hopefully all that gunk that you carry with you when you travel off of you.
And all of that obviously was pre-COVID-19.
Yeah, and now it's just that much more. I think we were used to being a little bit more strict than normal parents were anyway because of his diagnosis, and we still are quite a bit more, I think, restrictive than most parents are. We don't go to the grocery store anymore. We're doing everything kind of online.
Because they were saying the risk of even us just bringing something home to him was too great.
So we're fortunate enough that Barb's mom watches him during the day while we work, so he doesn't have to go to a daycare or anything like that, which his team is very thankful for, so that we can keep him safe. She has since, his team suggested that she move in with us for the time being instead of coming and going. We were fortunate enough that she was willing to do that, and she's been with us here for almost 4 weeks now. So we're kind of hanging in until we know more. I mean, we've been in contact with Benji's team, both his pediatrician and his team at the hospital, just to kind of get guidance as to what to do and what it looks like next. But so we're kind of in wait and see mode right now, to see what
Can you say hi?
What it looks like going forward, because we honestly don't know. For most people, being able to get out of the restrictions and lockdowns and things like that is great news, but we don't know what that means. I mean, he's obviously high risk, but we just don't know if that means that we continue to lock down like we were before, or like we've been doing now. We just don't know. So we're kind of hanging in there, waiting for guidance and having fun with the little guy.
It is hard though, because a lot of the extra follow-ups that we've needed, just given his start, have been postponed because, hearing tests that are so important to make sure there's not hearing loss from ECMO, those things were put on the back burner until they really feel like it's safe to have him out and about. So the pulmonologist had removed his oxygen support during the day and then just had him wearing it overnight. And then this past January, she said, I think he can go without it. Let's just have him wear the monitor and we'll see from there. So hopefully we can go back to the clinic. We're due back sometime next month. And hopefully that doesn't get pushed out, because I think we'll know more then about, does he even still have to sleep with the pulse ox monitor, or are we at the point of maybe getting more equipment out? So we'll see from there. We do use services through the area in which we live for occupational therapy, for dietitian services. He's got a follow-up with a speech pathologist coming this week. And again, all of that is virtual. But that is the beauty of where we are in the technology today, that we can still continue some of those things. He's walking, he's talking a little bit. We're working on kind of animal noises and those types of things. And really it's just chasing after him.
Wow. He looks great. Hi, Benji.
Hi.
Is your phone ring?
How's feeding going?
How's feeding going?
Mm-hmm.
You know, it's okay. I think it's really helpful having the occupational therapist and the dietitian that check in with us so frequently, because we have a dietitian through obviously the hospital as well, but these services are the people that see him more frequently. Do you want to make sure she gets him? So they know him and what's kind of his normal and, you know, those types of things. But in a weird way, it's refreshing when you get to the point that people say, I know that's frustrating, but that's normal behavior. That's normal toddler behavior. And, you know, as parents, it was amazing when we would worry about, okay, is this sleep regression or something that was like a normal baby worry? So, you know, it's hard because some of the things that were his favorites aren't anymore. He definitely has a thing with certain textures or certain temperatures. We even tried like a first bite of ice cream last week, and he was like so repulsed by it, didn't want it anywhere near his mouth. So he does still take 3 bottles a day. And I know that there are those specialists that say that's weird. He's, you know, over a year and a half and shouldn't be on infant formula. And for me, it's actually, I know he's still getting calories and nutrition that way. So if he doesn't eat a great solids meal, he's getting something. So kind of back to that knowledge is power, but making sure you have a broad set of knowledge and then kind of creating it's almost a choose your own adventure novel. You know, here's the path we want to take on feeds. Here's the path we want to take on sleep, those types of things. So it's an ongoing battle. We obviously haven't had him out and about much, but there are things that the pulmonologist has said that we'd never even thought about. So fast forward a couple of years, if he's doing well and we've been able to start introducing him to the public and build up some immunities, we still can't take him on an airplane because they don't know how his body will handle the change in pressure. They don't know if his lungs will be able to sustain him. Just like we couldn't take him in the car and drive somewhere. You think, okay, if we can't fly, we'll drive. We're in the middle of the country. We can't put him in the car and drive him through the mountains because they don't know how his body will handle the change in elevation and would his body be able to sustain him. So, and that's okay. I mean, we just got to introduce you to our son, and but it's just different, and there, every day brings something else that you think, oh, I hadn't thought about that. But every day also brings, you know, the other CDH families that we've connected with. We know every patient is different, and everybody has a different outcome. And so we know that there are lots of things that other families are going through that, you know, we didn't experience, and vice versa. And I think that's what makes it so frightening. It's just there's not this, okay, this happens and then you do this and then they get better and then everything's okay.
Yeah. Well, he looks amazing, and you guys have done a wonderful job. I know it's not an easy journey, especially, you know, your first baby, especially, you know, your journey to have him here, but wow, it's paid off. I mean, he's a doll. Look at him. And he looks like he's doing very well, and I have no doubt that, you know, you're going to stay on top of everything. So we appreciate you sharing.
Can I just say one more thing? And this is really important. And I don't want to overshare here, but, you know, it took us a long time to get pregnant. We're older parents. We work really hard. And it's very easy when you get a diagnosis to say, okay, what did I do wrong? Early in my pregnancy, the dog got out and I was really stressed out and thought we'd lost her. And I thought, did me putting all that stress on my body cause a problem with him? Or did the fertility medications I had to take and those procedures that we had to go through, did that do anything to cause this? And I mentioned the team that we worked with, and when we went that first day and had the 8-hour consultation, and I can remember the doctor saying, and he wasn't trying to take a religious slant, and I'm not trying to preach to anybody, but he just said, you did nothing to cause this. You cannot fix this on your own. It's just how he was made. And whatever your beliefs are in a higher power or science, what have you, it's just how he was made. And he just said, I can see a lot of love and a lot of attention. And, you know, I think you need to think of it as your son will have limits, but not necessarily limitations. And so that was really important for us. I think the other thing I would say to parents going through this, obviously don't give up hope. You could take one step forward and 10 steps back, and then the next week he could be even farther ahead than he was the prior week. You just don't know. But, you know, really build your team. And for us, that was, you know, our family, our friends, the medical staff, getting primary nursing care when we could. We had a home health nurse for a long time when Benji was on oxygen full time. Our doula was amazing. So she was even coming to the appointments with us before Benji was born. So she was hearing everything about, here's what we're expecting, here are the range of outcomes, so that, you know, she really knew kind of how she could help best support us. So, you know, some people want a lot of people around and some don't, but I would just encourage that, you know, support is a lot more than just the medical community. And so whatever that is for you, if it's people bringing meals, if it's people's little kids drawing pictures that you hang up when you're in the hospital, those types of things, just there's nothing that doesn't help. And I know we had lots of family and friends that were saying, how can we help? What can we do? And it was as simple as even during the baby shower, instead of playing games, everybody was given 3x5 note cards and made different nameplates and signs that we could put on Benji's bassinet in the NICU. So there were lots of ways we could bring other people in, even though they couldn't come see him.
That's great advice. I'm glad you shared that idea. Thank you both so much, really. You did a great job telling a story. You really did. I felt like I was walking through it with you, so I appreciate that.
Thank you, Dawn.